Welcome to the sixth in our series of NADP conference podcasts. These podcasts are a series of interviews where we aim to get to know our colleagues and partners and learn about their experiences working in our sector. Today I'm talking with Sharron Sturgess, who was one of the partners who set up the Leicestershire Specialist Mentoring Network. Welcome, Sharron.
Morning. Thanks for having me on.
To start with, can you tell us something about you and your role within your actual institution?
Yeah, sure. So I'm currently an autism specialist, but I started life as a secondary school teacher, and I did that for a decade. And then when I had my children, I realised there must be easier ways to earn a living than teaching. And it turns out there was. I became a disability advisor at Loughborough University. And I worked there for a while, and I became the manager of the service. And then for various reasons, I wanted to specialise a bit more. So I kind of went into autism, done some qualifications, made that my specialism. And then I moved across to the University of Leicester, where I am now running the autism support. I'm the autism specialist, and that includes running the mentoring service for Leicester University. So I supervise a team of mentors as well as having a caseload of my own.
So how big is your team? You say you run a team, and how many disabled students do you support?
Yeah, so the Accessibility Centre, which is a disability service at Leicester, we're supporting about 1,800 students, and we have about 90 autistic students at the university. So those are the ones I have particular responsibility for. And working alongside me, I've got a team of 5 mentors, and we're probably mentoring about 50 students, although I aim to meet all of the autistic students that disclose to the university. These are the ones we know about, of course. I think there are many more autistic students that we're not supporting because they've not shared that information with us. But yeah, there's about 90 students. I've got 5 mentors, and we're mentoring between 50 and 60 students between us at any one time.
Okay, there may be some of our listeners who don't know about the UK Specialist Mentoring Service. Can you tell us a bit more about mentoring and who it assists?
Yeah, so the idea behind mentoring is it's about supporting students one-to-one to look at the barriers that their disability might place for them in their learning and their access to university life. I think there was a version of mentoring that existed before the DSA funded it, but in 2014 it was sort of set up as a non-medical helper specialist band 4 role. So there are basically 2 types of mentoring. So there's mental health mentoring that will work with students with disclosed mental health conditions to look at how they can remove the barriers they place. And the other specialist mentoring is for autistic students, which is the mentoring I'm involved with. And it's very much around working one-to-one with a student, look at the difficulties that they can encounter, that their autism might present for them, and the barriers, and helping that student to find the strategies that works for them. We're very much student-led role mentoring is. A good mentor, it's not about doing these things for students, it's about looking at why they're finding it hard to engage with their studies or integrate into university life or kind of get involved on a level that they want to get involved on, and helping that student to work out ways around those problems themselves. And for me, it's very much about teaching strategies, because if you do something for someone, they never learn to do it for themselves. And at the end of the day, we're with these students for sort of 3 or 4 years of their life, and then they're going to go off. So what you want to do is to give them the tools to manage their own disability for themselves. There is some mentoring that covers other disabilities. Certainly when I first started working and I was a generalist, I did a lot of one-to-one work with students with chronic fatigue and ME and cognitive injuries, so brain injuries. That's not funded by DSA anymore, but I do know of universities that still provide mentoring for those sorts of disabilities as well.
Yes, I was a mentor in the past and took mentoring qualifications, and quite a few of the students I supported would fall between the DSA bands now, with I had a young lady with autism, which she would receive mentoring for, but besides that, she also had very high levels of pain, and so she used to concentrate in on the pain due to her autism concentration, and get kind of spiral down into this little circle of pain, which was difficult. And I had another student with ADHD and chronic pain as well, and under the DSA system, she wouldn't receive mentoring now. It'd be up to the university to sort, I think.
Yeah, that's the other group that are really missing out, because that's my other current specialism, is students with ADHD. And they kind of go between myself and our study skills service that support neurodiversity, mainly dyslexia. But actually, quite a lot of those with ADHD have similar sort of issues to autistic students. Just sort of need help working on strategies to help them manage their lives, help them manage their conditions. And that's not always related to study-related things, because we're supporting students to kind of manage their day-to-day routines and also manage things like their sort of social lives, their self-esteem, the other side of university that people don't think about when they apply. They think about doing their degree in the academics, whereas good mentoring will look holistically at the whole student. And I think students with ADHD benefit really well from mentoring in the same way that autistic students do. But as you say, it's not DSA funded. And I think this is the other problem mentoring has. Good universities with lots of resources can provide mentoring to any student that need it. But quite often, with the squeezing of resources, particularly as we're coming out of the pandemic, lots of universities are depending on DSA to fund their mentoring services. At my institution, I've got a certain degree of flexibility. I'm a full-time member of staff, so I tend to pick up the students who are not DSA funded. But my mentors are obviously, they're 0 hours contracts, so they're being funded through DSA. So it varies from institution to institution, but really mentoring is something that a lot more students than those funded through DSA would really benefit from.
Yeah, and it needs to be specialist mentoring as well. It can't be peer mentoring when it's something like ADHD, and you need to have a good idea of the techniques and strategies that will really help.
Absolutely, yeah. You could do more harm than good if you don't know what you're doing.
Yeah.
As with anything.
So actually, we wanted to talk today about the specialist mentoring network that you set up. Can you tell us a little bit about who was involved and why it was set up?
Yeah, it was all quite fortuitous, really. So when I left Loughborough and moved over to Leicester, one of my mentors at Loughborough that I'd sort of been mentoring her in her sort of career progression, she then stepped into my role at Loughborough, the autism specialist role, because I was sort of the autism specialist there and a service manager, but she took up the autism role. And we kept in touch because it's obviously quite a big step up for her. And we started to have discussions about, she wanted to provide training. I was doing training. Could I help her out? And then at the same time, I was working alongside someone who actually became the autism lead at De Montfort University, which is our other local university in Leicestershire. And then she got the job as the autism lead at De Montfort. We were working on the REACH partnership, which was kind of came after Aim Higher. So we were doing work in Leicestershire around supporting disabled students to go to university. And then when that project finished, became the autism lead at De Montfort. And so it came out of the fact that I just happened to know my counterparts at the other local universities, and we were all facing the same sorts of issues. We had this mentoring team, and it can be quite a lonely endeavour, mentoring. It's you one-to-one with a student. Mentors are quite often, they're not full-time members of staff. They will be 0 hours contracts. They're sort of floating in and out of the office. They might see their supervisor, but they're not necessarily meeting up with each other. And the three of us kind of got together and thought, well, we think actually if we pool our resources, we can put on some good mentoring training and then give mentors an opportunity to network with each other and learn from each other. And so we sort of thought, because the three of us knew each other, that we'd pool resources, really. And so I offered to host a meeting at Leicester, and it sort of took off from there. And the pandemic has sort of disrupted proceedings. But until then, we were having regular meetings. I would host a meeting in January at Leicester, and then my colleague would host a meeting in June at De Montfort. And we have between us anything between sort of 20 to 25 mentors that would come together, and they really like the opportunity to network with each other. I think that's been the most successful aspect of this, is that mentors feel they're part of a growing service and they're not just working in silos on their own with students. And
yeah, they
hear that other people are having the same sorts of issues and worries and concerns about their work that other people are. And again, that just makes them feel part of the team.
Yeah, I think also so much of mentoring is keeping up to date with new techniques and new strategies and hearing about things that have helped other students. It's really important to be able to network on others and actually gain that knowledge.
Yeah, absolutely. It's funny, whenever I go to training, especially with NADP, when you go to conferences or face-to-face things, when you put on your feedback form, what's the most useful thing out of the day, I always put the networking, because just learning from other colleagues and knowing that we all face the same sorts of issues, and quite often I think as autism specialists, you might be the only autism specialist in your university, and then I've got this team of mentors looking to me for all the answers. I don't have all the answers, but I know that if I reach out to my colleagues, someone else will. And I think that's the premise of networking, isn't it? It's knowing that you haven't got to do it all on your own. You're not the only person doing that. So you don't need to keep reinventing the wheel. You just need to look out externally and reach out and see who's around you. And because we wanted something that was face-to-face, we've done it in our locality. We've got 3 big universities in quite close geographical locality. And again, I think that helped as well. So the fact that we knew each other, and our universities are quite close, and we all had reasonable sized services that we could pull resources, that the network just kind of evolved from that really quite easily. We also all had buy-in from our managers. They were all quite happy to let the 3 of us go off and set up something between ourselves. We don't have many resources, so we've kind of pulled what we do have. But I think buy-in from management is also a big help. If you've got a manager who will trust you to reach out and see who else in your local institutions will support you, that's a big help as well.
Yeah, that kind of leads me into saying I'm sure that there are many of our members thinking it's a kind of great idea to set up a local network like this, because funding is just so short, or shall we say non-existent, for CPD at the moment. And so I was going to say, do you have any advice for the first steps people would need to take to set up something similar? But I think management buy-in is definitely number one, isn't it, really?
Yeah, absolutely. I'm very fortunate. I think because I've done management myself, and my manager just sort of lets me go off and leaves me to it. But yeah, I think certainly if your service manager will let you take those first steps, that's the first thing to do. The second thing is then to find out who is in your locality, because quite often in counties there are more than one universities. You tend to find a cluster of universities near each other. So I think it works easiest if it's in your locality. So finding out who's near you, reaching out to their autism leads, that's a good second step. And the other thing I think that helps is then, as I say, pooling your resources. So looking at what training they've done, what training you've done, and not reinventing the wheel. You don't need to do that. Quite often there's things already out there, really. And what we've also done is we've pulled in external people. So at my institution, for example, student services, they were doing a lot of work around having difficult conversations and working with, they call them difficult people. I don't think autistic people are difficult, but having those difficult conversations and what to do when people disclose things to you. So that was a piece of work going on in our university anyway. And I thought to myself, well, actually, this would be really useful for mentors. So the last face-to-face session we had in January 2020, I had the practice lead from student services in my university. She came and delivered her training to the specialist mentors. and it was something a bit different. And although most of the training that we deliver is one of the three of us practice leads in the universities, actually, if you can bring external people in, whether that's external people to your service within your institution or external people from outside, if you've got local links, that helps as well, because I think the mentor training, you need to benefit from it as the practice lead as well. So if you're always putting it on, you don't necessarily get the benefit of the training in the same way. So using whatever else's training is out there. And as you say, I think it's a really good way of upskilling yourself as well. So we put on training that mentors ask for, and they've asked for quite a lot of mental health training. So we did run a session where I did something on selective mutism because I had to have been to a conference. And so I read up quite a lot about it. I made some contacts at the conference that I went to. And then it was quite good. You know, it's that premise that a good way of knowing that you've understood something is then to teach it to somebody else. So because I'd got a selectively mute student, so by doing some reading, some research around it, going to a conference, I was then able to put together a presentation and present that to the mentors. One of my other colleagues had dealt with a number of students with Tourette's, and she did the same sort of thing. And, you know, so we all put on a sort of mini presentation about something that we'd been dealing with that we hadn't dealt with before. And again, the mentors were all able to sort of benefit from our having to upskill ourselves as well.
That's great. Yeah, I can really see how it would work so well for mentors. I home educated my kids, so I changed careers from biochemistry, and I moved into note taking, mainly for science subjects, and then I did SPLD tuition training and mentor training, and I was also doing exam invigilation training as well. And so I moved into all those areas. But when you're remote from the university and being paid perhaps by an agency, you don't have the contacts that you need to get the training that you need either. And money can be limited to go to conferences and pay for yourself. So I think it's a fantastic idea. And I know I would have really appreciated it when I was working in mentoring and SPLD tuition in that area.
In fact, you've just reminded me, I mean, I'm focusing on the 3 universities based in the network, but actually we're wider than that. So we've got a couple of local further education providers who are doing, the foundation degrees, who do some DSA work. So we've got Loughborough College and Brooksby Melton College. And we actually have the Learning Support Centre, who are one of the big non-medical health suppliers based in Leicester. They sort of grew out of the service at De Montfort University, and I happen to know Laura Cook as well, and I sort of met her semi-socially one evening, and we got chatting about work, and sort of told her about the network, and she was interested in that. So they're actually part of our network. So it's not just the universities. We recognise that, the sort of the private suppliers, as it were, they're all facing the same sorts of issues we are. So, we've had the Learning Support Centre involved with us, and Laura has offered up resources, things like, using their training rooms if we need to, and that sort of thing. So, again, it's pooling resources, isn't it?
Yeah, and it's great. And I'm so pleased to hear that you're including further education as well. We have quite a few colleges as members, and they find it even harder than our university members to get CPD at an adequate level for what they need. So it's wonderful that you're forging those links as well.
And again, that came out of people that we knew. Bizarrely enough, a very good university friend of mine, her partner is actually the head of learning support at Loughborough College. So that's how I said to him, "Do you have an autism lead? We've got this network. Do you think they'd want to join?" And then Brooksby Melton, the lady that was the autism lead there, she was on the Reach partnership with myself and the colleague at De Montfort. So again, it all came from people knowing each other. It is true what they say. It's not what you know, it's who you know. But hopefully it's been mutually beneficial. And if you don't know people in your sort of local area, then you just need to go out and find out who they are, really. You just need to contact the other local universities and make those connections for yourself. But you do tend to find, I think, in this sector, because it's quite a niche sector, isn't it, that people tend to move between local institutions. I know certainly between Leicester, Loughborough and De Montfort, staff kind of move between the three. I know people who've worked in, two or others of the institutions. So it's building on that, really. It's building on those professional networks and friendships that you make along the way.
Okay, now we hear an awful lot about inclusivity in our roles as disability practitioners. So how do you think that mentoring assists with inclusivity?
I think it can work in two ways, really. I think, first of all, it's about supporting that student that you're working with to support themselves and help them to take ownership over their own disability, because they've come from school where quite often the SENCO or their parents have done everything for them, and now they're becoming an independent young adult and they want to be included in things, but they've got to learn to do that more for themselves. And I think mentoring can help support young disabled people to do that, to take ownership and decide on how much inclusion that they want, because some autistic people are much more self-sufficient and want to stay, particularly in a social aspect, might want to stay in their own world, but in many ways, they want to be a part of university life. They want to get the most out of university life, not just do a degree. So mentoring can help a young person in that regard, to support them to include themselves as much or as little as they want to. And then the other side of it, and I think this is kind of a run-off from the general disability advisor role or the autism lead role, that my mentors will then also work with departments. And again, my mentors, because we're all based in the institution, we're probably a bit better able to do this than every mentoring service. But I think if you're based within an institution, it's about supporting that student to advocate for themselves and working with a department to get them to see how they could include students more. So that comes more under the guise of universal design for learning, if you like. So I know that some of my mentors have been for meetings with departments to discuss with departments things like making adaptations to group work, putting reasonable adjustments in place for assessment, and supporting that other side. So it as a disabled person myself, I always feel that disability, it's sort of, you've got to meet the world halfway. I know that I take ownership over my own disability, and I know what my limits are, and I've been supported, in my life to recognise that, so I can advocate for myself. But on the other hand, you also need the world to take account of the fact that you don't fit into it the same way as everybody else. So you need them to meet you halfway, and that's the university, isn't it? And I think mentoring is uniquely placed to see both sides of that, to see what a student needs, to see what the university needs to do, and to help them meet in the middle, as it were.
I do like that concept. That's great. Yeah. And I think it really helps to explain what mentoring is as well. Yeah, good one.
Yeah, I think it helps build that bridge, doesn't it, between the two sides of that coin, because you can't sit around thinking that the world's going to bend to your exact will because you're disabled. You've got to learn to advocate and learn those strategies, as I was saying before. As an autistic student, you need to learn those strategies to improve their own lives. But then there's an awful lot that universities do that do put barriers in place for autistic people, and hopefully mentoring helps the university recognise that and remove those as well.
Yeah. The other term we're beginning to hear an awful lot about now is intersectionality. It's certainly helping us at NADP to increase understanding that one size does not fit all when it comes to disabled students. Not every dyslexic student is the same as every other dyslexic student. Can you talk a bit about how intersectionality affects mentoring?
Yeah, I think there's certainly some, as a mentor, you're not just working with an autistic person, you're working with a young person that may have other things going on. So whether that's that they're from the BAME community and they've got a cultural aspect, Or something that we do see a lot of within the autistic population is the LGBT community. And certainly I started to work with quite a number of transgender students, and I sort of asked my mentors, they were like, yeah, a lot of their students identified with the LGBT community, and we thought this was an area that they might benefit from training. So we did have a training session where I actually bid for some funding, and we brought in an external speaker from the LGBT Centre in Leicester, and they came to speak to us to just widen people's understandings of the community. And then I held a session in the afternoon around then, what does that mean for our work with young autistic people? Because if it's a community that you're not particularly embedded in within yourself, particularly around transgender issues, I think, people have got their heads around, people can be lesbian or gay, but I think the needs of transgender students are very different and very particular. And I mean, 3 of my new starters this year identify as transgender, and you want to make sure that you're respecting what that means for them and understanding what that means. And I've got a 4th student who's sort of questioning. And I think the nature of mentoring can become quite an intimate professional relationship, that students will open up to you or tell you things that they've perhaps not told other people. So it was very much about training our mentors to recognise what that means for a young person who's exploring their identity and that intersectionality with autism. Because I think quite often in the autistic community, it gets passed off as, no, you're not trans, you're autistic, or you're trans, but you're not autistic. They don't see that the two, you've either got one or the other, and that's not the case, but one can affect the other. So we sort of did some training around that, and then very much training around sort of our boundary issues and where we fit into that as mentors, because I think that's a big thing. If you're mentoring, you need to know the limits of your own capabilities and then the limits of what you're expected to do as well. You can't do everything and be everything, but you can increase your understanding in order to support that young person to increase their understanding of themselves. So yeah, I think intersectionality, it is a big thing. And as I say, for us, I think the big one for us has been the LGBT community, but then there are those students who work with cultural issues, and those students that we work with that also come from non-traditional backgrounds. We get quite a lot of older people who find out they're autistic in later life. So they're studying not just as an autistic student, but as an autistic student with a recent diagnosis, and is also a mature student and will have other responsibilities. So yeah, I think the intersectionality for any disabled student is a big thing. And I think it's important that we support mentors to understand that, so that they can then support the students in learning to understand themselves better.
Yeah, I think in any of the kind of caring professions or caring roles, that boundary issues are so important. And I think especially with these one-to-one work roles where you're working so closely with the student, those boundary issues are, you have to be well aware of where you're going to hold that boundary, and any things like your specialist mentoring network are just so vital for people to be able to discuss that out and work out exactly where they're going to hold the boundaries, because it's a personal decision on every single occasion, I think.
Yeah, absolutely. And autistic people, they work better with clearer boundaries. Yeah. So I'm very clear with my students, for example, they can email me anytime, but they can't expect a reply from me anytime. Yeah. If they're having a difficult day, they can ask me if I'm free to meet, and if I'm free to meet, I'm free to meet. But if I'm not, I'm not. And I will, so I'm very clear with them about their sort of access to my support and advice and guidance. And that's very much something I have to install in my mentors, because, you work closely with a young person, you get professionally invested in how they are and how they're doing. And then, there's quite an element around sort of safeguarding and the university's responsibilities to its students. But, we're only a part of that. And I think when you're a mentor working with a student, you can feel like it's all on you, and it's not. And again, as you say, I think there can be a lack of supervision and support for mentors. And I think having regular network meetings, whether that's within the mentors within your own institution or indeed with other local institutions. If you set up your own network, it gives those mentors an opportunity to kind of offload to each other. And as we've already said, learn from the fact that other people have had the same dilemmas as you, that you're not the only person with that. So I think that's really valuable.
So, okay, what's the biggest challenge you have with your specific role right now? And do you have any ideas at all on how you're going to overcome it?
I'm overworked and underpaid. And I don't know how I'm going to resolve that. I mean, I'm certainly, it's workload, isn't it? It's always workload and lack of resources. And I mean, I've been doing this work a long time, so I know not to get stressed out about workload. And I know that when I was managing, you learn to delegate, don't you? You learn to start to say no as well. And you learn to sort of be a bit clever about what you're doing. And as for resources, that's where things like the mentoring network came in, because although it feels like it's an effort to put something on for a group of people, actually, we've all got to do CPD under the DSA quad regulations. We all need to do at least 10 hours a year. So if I can get those hours in by putting on a 2-hour session with my mentors, then, again, you're working smart, aren't you? You're pooling resources, you're being clever about what you do, and you don't have to do it all yourself. I keep coming back to that phrase, don't I? Reinventing the wheel, because I do think sometimes we think we've all got to go back to the beginning and start over, and you don't have to. Somebody out there will have done something that you can, and that's fair. The email forum that we've got, the practitioners network, because I think that's the next step for us as a group of professionals, is to have an autism practitioners network, which has started with the email list, because if you put on the email list, somebody somewhere will have done what you're trying to do. And we're quite a good bunch, aren't we? We're quite good at sharing amongst ourselves, and again, that helps us as individuals work smarter, because we haven't got the time in the day to keep doing things from scratch.
Yeah, it's the GISMail list for our NADP members is one of the most valuable things of membership, and we hear that time and time again, because I'm at a small university, and I'm the only disability advisor at the university, and I've now got a blind student coming to study biology, and can anyone help? Absolutely. Because it's quite a niche area, as I've already said, that we need to reach out and support each other, because you can't possibly know everything about everything. I think managing workload is something, and then being clever about the resources. That's the way I'm currently trying to manage my current role. Okay. Coming back totally to you for one final question then, what's something about you that most people familiar with you and your work wouldn't know?
My problem is I'm a bit of an open book. I think everybody knows everything about me. But I think it would come back to my own disability status. I'm very upfront about the fact I'm disabled, so I've got a vision impairment. And I think it's easier for me to share that information with people, because I need people to know that I can't see very well. So, if you go into a conference, for example, you need the alternative formats, or you need the presentations beforehand, or things like that. And I've also, working with young disabled people, I always think, I don't like that idea of being a role model. I don't like to put myself above anybody else, but I know that it's a way of empathising with the young people I work with by saying, I genuinely understand the difficulties you're having, because as a disabled person, I've had it myself. So, most people know about my disability. The one thing I would say is I don't think people know quite how poor my sight actually is, because I think I do myself a disservice sometimes that I'm of that generation where it was more medical model. I went to a special school where you couldn't play on the fact you couldn't see, because nobody else could see either, and you just had to get on with it. And we didn't have large print books, we just had big old magnifiers instead. So it was very much about changing yourself to fit in with what society needs, and it's not like that now. But I know for myself, I've still got that hangover. So I think, although I tell people I've got poor sight, I do play it down quite a lot, and I don't think people realise quite how poor my sight actually is. And it's always hard to explain, because when somebody says, well, what can you see? I don't know. What can you see? I've got no frame of reference. I've always had poor sight. So it's like, well, I don't know. It's not quantifiable. But I think that's what people don't appreciate. And I think it's a huge benefit to me in this role, because I think you have real empathy when you're a disabled person supporting other disabled people, because you can genuinely say, yes, I do understand what you're going through, because I've been through it myself.
Yeah, and you know, we were talking about intersectionality, and one size doesn't fit all. So no disabled person is the same as any other disabled person, but some of our experiences will be similar, and just gives us, as you say, that understanding of not totally what they're going through, but it enables us to empathise that little bit more, I think. Yeah.
And it gives me that legitimacy to say to a young disabled, and I have said this to various students I work with, you know, the world will not bend to your will. You have got to learn to take ownership and have some agency over your own disability. And I have the legitimacy to say that, because I've been through that. You know, when you go to uni, you want to be the same as everybody else. I see it with the first years who just want to fit in, and then they realise they're not going to do it quite the same way. And I just say to them, I've been through this. And by the third year, they recognise they can still fit in, but in a different way, you know. And as I say, I think that's where being a disabled person myself, I think, has great benefit in this role.
That is great. Thank you very much for sharing your time and all your knowledge with us this morning. And yes, it's been a really interesting session. So thank you very much.
Thank you. Thanks for having me on.